Oley has done a systematic review meta-analysis of diabetic foot ulcers based on Wagner's data. As mentioned before, this is really a hot topic because there is solid evidence that this actually works over and over and over again. So when you see a person who wants to be published as an author, they take a contradictory stand so they can be sensational and get their published paper in. So while there's good evidence that it actually works, you have people who try to make papers that say it doesn't. So how do you remove that bias? Systematic review meta-analysis. And the result here is hyperbaric is significantly superior to other treatments for wound healing 8 or more weeks after the final treatment. There's less minor or distal amputations. There's less major or proximal amputations. There's complete wound healing for Wagner's 2, 3, and 4. There's decreased minor distal amputation for grade 3s and major proximal amputations for grade 4s, and decreased outer debridement for Wagner 2. So again, there is strong evidence this is really, really good. And when people say otherwise, it's obviously a problem. It's just their vested interest and want to get published. But what we have to keep in mind here is the basics of this. And the basics are, if a person has a diabetic ulcer, getting them in the chamber as fast as possible when they're medically stable is the best thing you can do for them. The lower the grade, the less the wound, the better they're going to do with this for the rest of their life. Of course, what happens is the surgeons tend to hang on to these patients. They don't allow them to come until everything is hopeless. And then when the limb comes off, blame the chamber. It doesn't change the science. So if we don't go with science, we can't expect proper outcomes. But early hyperbaric, always a good thing in diabetic wounds, no surprise.